If you're waking up 3 times a night to pee, struggling with a weak stream, or feeling like you can never fully empty your bladder, your prostate is trying to tell you something. And before you rush to the pharmacy, there are 5 natural oils that research shows can actually help shrink an enlarged prostate. Number 3 on this list reduced prostate size by 30% in clinical studies, but almost nobody talks about it. Stay with me for the next 10 minutes because I'm breaking down the exact oils, the science behind them, and most importantly, how to actually use them safely and effectively. Hey everyone, welcome back to the channel. If you're new here, I'm Naim, and on this channel we cut through the health noise and give you evidence-based information you can actually use. Now, I want to be crystal clear upfront, I'm not here to sell you miracle cures. An enlarged prostate, or BPH, benign prostatic hyperplasia, is a serious condition that affects over 50% of men by age 60. If you're experiencing symptoms, you absolutely need to see a doctor first to rule out anything more serious. But here's what's fascinating. While conventional treatments work, they often come with side effects like sexual dysfunction, dizziness, and fatigue. And the research on certain natural oils is actually pretty compelling. We're talking peer-reviewed studies, not just folklore. So today, I'm sharing 5 oils that have legitimate scientific backing. I'll explain what the research actually says, how they work, and the practical ways to use them. And if you stick around until the end, I'll give you a simple daily routine that combines these oils for maximum benefit. Section 1. Oil number 1, Saw Palmetto Oil. Alright, let's jump into oil number 1, and this is probably the most well-known, saw palmetto oil. What it is, saw palmetto comes from the berries of a small palm tree native to the southeastern United States. The oil extract from these berries has been used for prostate health for over a century. The science, here's why it works. Your enlarged prostate is primarily caused by an enzyme called 5-alpha reductase. This enzyme converts testosterone into DHT, dihydrotestin, which causes prostate cells to multiply and your prostate to grow. Saw palmetto oil blocks this enzyme, similar to prescription drugs like finasteride, but with fewer side effects. A 2012 Cochrane review looked at 32 randomized trials involving over 5,600 men. While results were mixed, several high-quality studies showed that saw palmetto improved urinary flow and reduced nighttime urination by about 25%. How to use it? The standard dosage in studies is 320 mg per day of standardized extract containing 80 to 95% fatty acids. You want to take it with food because it's fat-soluble. Look for supplements labeled standardized extract. Quality matters here because many products on the market are underdosed or poorly absorbed. Real talk, saw palmetto isn't a quick fix. You need to take it consistently for at least 4 to 8 weeks before seeing results. Some guys notice improvements in 2 to 3 weeks, but patience is key. One quick tip before we move on: if you found this information helpful so far, go ahead and hit that like button. It helps the algorithm show this to other guys who need it. Alright, let's keep going. Section 2. Oil number 2, Pumpkin Seed Oil. Oil number 2 is one that surprised me when I first researched it: pumpkin seed oil. What makes it special? Pumpkin seed oil is loaded with zinc, phytosterols, and essential fatty acids. Your prostate actually needs zinc to function properly. It's the organ with the highest zinc concentration in your entire body. When zinc levels drop, prostate problems often follow. The research, a 2019 study published in the Journal of Traditional and Complementary Medicine, followed 60 men with BPH for 12 weeks. Those taking pumpkin seed oil showed significant improvements in urinary symptoms and quality of life scores. Their nighttime bathroom trips decreased by an average of 40%. But here's what makes pumpkin seed oil unique: it doesn't just block DHT like saw palmetto. It also has anti-inflammatory properties that can reduce prostate swelling and irritation. Think of it as attacking the problem from 2 angles. How to use it? Most studies used 500-1000 mg daily, split into 2 doses with meals. You can also get cold-pressed pumpkin seed oil in liquid form. 1 tablespoon gives you about 14 grams, which is way more than capsules. Some guys drizzle it on salads or take it straight. Pro tip: buy oil that's cold-pressed and stored in dark glass bottles. Light and heat destroy the beneficial compounds. Keep it refrigerated after opening. Now, Before we hit oil number 3, the really powerful one, I need to address something important. Quick question: are you currently dealing with prostate issues, or are you watching this to prevent them? Drop a comment below and let me know. I'm curious about who's in the audience, and it actually helps me create better content for you guys. Also, if you want a free downloadable PDF with dosing charts, safety information, and a 30-day tracking sheet for these oils, I've linked that in the description below. Completely free, no email required. Alright, let's talk about oil number 3, because this is where it gets really interesting. Section 3, Oil number 3, Pygium africanum bark oil. Oil number 3, Pygium africanum bark oil. This is the one I mentioned at the beginning that reduced prostate size by up to 30% in some studies. The background: Pygium comes from the bark of an African cherry tree. It's been used in traditional African medicine for generations, and European doctors have been prescribing it for decades. It's actually one of the most popular prostate treatments in France and Italy. The impressive research, a meta-analysis of 18 randomized controlled trials involving 1,562 men, found that Pygium significantly improved urinary symptoms and flow measures. But here's the kicker: ultrasound measurements showed actual reductions in prostate volume. We're talking measurable shrinkage. How it works: Pygium contains phytosterols and pentacyclic triterpenes, don't worry about the names, that reduce inflammation in the prostate, improve bladder muscle function, and reduce the hormonal signals that cause prostate growth. It's like a triple-action formula. Dosage: the standard dose is 100 to 200 mg daily of standardized extract, usually 13 to 14% triterpenes. Some men split this into 250 to 100 mg doses. Important note: Pygium is endangered in the wild because of overharvesting, so make sure you buy from companies that use sustainably sourced or cultivated Pygium. Look for certifications on the label. Alright, we're halfway through. 2 more oils to cover, and then I'll give you that combination routine I promised. Section 4, Oil number 4, Stinging Nettle Root Oil. Nettle root oil. Now, you might know stinging nettle as that annoying plant that makes your skin itch when you brush against it on hikes. But the root extract is actually a prostate powerhouse. The science: stinging nettle works differently than the others we've covered. It contains compounds called lectins and polysaccharides that bind to sex hormone-binding globulin, SHBG for short. When SHBG is bound up, there's less free testosterone available to be converted into DHT. Less DHT means less prostate growth. Studies show that nettle root doesn't just help with symptoms, it actually works synergistically with saw palmetto. When you combine them, the effects are stronger than either one alone. The evidence: a 2005 study in the Journal of Herbal Pharmacotherapy tested a combination of saw palmetto and nettle root on over 500 men for 48 weeks. The results? 81% of participants reported improvement in urinary symptoms, and prostate size decreased significantly with minimal side effects. How to use it? Look for supplements containing 120 to 300 mg of stinging nettle root extract daily. Many quality prostate supplements actually combine nettle with saw palmetto because of that synergistic effect. One thing to watch: nettle can interact with blood thinners and blood pressure medications, so definitely talk to your doctor if you're on those. Now, the 5th oil is a little controversial, but the emerging research is too interesting to ignore. Section 5, Oil number 5, Omega-3 Fish Oil. Oil number 5, Omega-3 Fish Oil. Why it's on this list? You've probably heard about fish oil for heart health, but its role in prostate health is less talked about. Here's the connection: chronic inflammation is a major driver of prostate enlargement. Omega-3 fatty acids, specifically EPA and DHA, are among the most powerful anti-inflammatory compounds we can consume. The research, a 2013 study in the American Journal of Clinical Nutrition, found that men with the highest omega-3 intake had a 63% lower risk of aggressive prostate disease. While that study focused on cancer prevention, other research shows omega-3s reduce overall prostate inflammation, which can help with BPH symptoms. A 2020 study measured inflammatory markers in men with BPH before and after 12 weeks of high-dose omega-3 supplementation. The results showed significant reductions in prostate inflammation and modest improvements in urinary flow. The controversy: I need to be honest, Some older studies suggested high omega-3 intake might increase prostate cancer risk, but those studies have been heavily criticized for methodology issues. The current scientific consensus is that omega-3s are beneficial for overall prostate health when balanced properly. How to use it? For prostate health, you want 2 to 3 grams of combined EPA and DHA daily. That's typically 2 to 3 standard fish oil capsules. Always take with food to improve absorption and reduce fishy aftertaste. Look for molecularly distilled fish oil to avoid mercury and other contaminants. Brands that have third-party testing are your best bet. Alright, we've covered all 5 oils. Now let me give you that practical routine. The combination routine. Here's a simple daily routine that combines these oils safely. Morning, with breakfast. 320 mg saw palmetto extract. 500 mg pumpkin seed oil. 1000 mg omega-3 fish oil. Evening, with dinner. 100 mg pygeum extract. 120 mg stinging nettle root extract. 500 mg pumpkin seed oil. 1000 mg omega-3 fish oil. Important guidelines. Start with ONE oil at a time, for 1 week each, to see how your body responds. Don't jump into all 5 at once. Give it time. Most men see noticeable improvements after the 6th of August weeks of consistent use. Track your symptoms. Use a bathroom diary to monitor nighttime urination, flow strength, and frequency. Objective data helps you know if it's working. These oils are not a replacement for medical care. If your symptoms worsen or you see blood in your urine, see a doctor immediately. Talk to your doctor before starting, especially if you're on blood thinners, blood pressure medication, or planning surgery. Some of these oils can affect bleeding and drug metabolism. Look, dealing with prostate issues can be frustrating and embarrassing, but you're not alone. Millions of men are going through this, and the fact that you're here researching natural solutions shows you're taking your health seriously. These 5 oils, saw palmetto, pumpkin seed, pygeum, stinging nettle, and omega-3s, all have solid science behind them. They won't work for everyone, and they are not magic bullets, but for many men, they can make a real difference in quality of life. If this video helped you, do me a favor, share it with a friend or family member who might need it. Prostate health isn't talked about enough, and we need to change that. Don't forget to grab that free PDF guide in the description. It's got everything we covered plus safety checklists and tracking tools. Subscribe if you haven't already, hit the notification bell, and I'll see you in the next video where we're covering the worst foods for prostate health. Trust me, number 2 will surprise you. Take care of yourself, and I'll talk to you soon.